This is WJZ-TV, Baltimore.
In your community, where you live. Now, it's WJZ, Maryland's news station.
I'm Alex Dimitrick, and coming up, a cancer deadlier than anyone thought. That story as Eyewitness News continues.
65 used to be the age most women stopped worrying about cervical cancer. But Alex Dimitrick reports in tonight's WJZ Health Watch report, a Johns Hopkins study found that age cutoff may be fatally wrong.
Seeing blood clots may have saved Lisa Serp's life.
The next day they called and told me I had cervical cancer, and they set me up to see my gynecologic oncologist, and he gave me a couple of options, and I went with the radical hysterectomy.
A study by Johns Hopkins finds more women than expected may be dying from cervical cancer. 77% more deaths for black women, 47% more for white women.
You know, I think the thing that concerns me the most is, did we fail at screening them, follow-up, treatment, intervention, or what is their access to medical care?
It might come down to age. If free from cervical cancer by 65, pelvic exams and pap smears are usually not recommended. The study found that may not be the best practice.
And what they were finding is that there was an increased risk of death for those patients with cervical cancer. Maybe these patients over the age of 65 should be screened.
For survivors of cervical cancer, the advice could not be more direct.
I strongly encourage people to keep getting their exams.
Alex Dimitrick, WJZ, Eyewitness News.
And when screening and follow-up monitoring are used, cervical cancer is largely preventable.